When you are gathering sources of information or gathering information about your patient, you can look to various sources. You can talk to the patient themselves, which is the most common. You can talk to members of their family, especially if it's a pediatric patient or a patient with certain challenges. You can look at a patient's medical records, current and past. You can take a history, what's going on with that patient, or look at the healthcare provider's history. And then lab reports, a nice objective way to tell what's going on with the patient physically. You're going to be examining the patient yourself and using certain techniques to gather data. You're going to be watching them very closely. You might palpate certain parts of the patient's body to see what you can determine through touch. Sometimes you'll palpate a patient's abdomen gently and see, is it firm, is it soft, do they act like they're uncomfortable. You're going to listen with your stethoscope to the abdomen, to the lungs. You don't see percussion quite as much as you used to, where you sort of tap on various areas of the patient's body. We have ways of checking out patients, x-rays, MRIs, CT scans, that make percussion not quite as common as it used to be. Sometimes you might still see a healthcare provider use percussion on the patient's abdomen, kind of like they're, checking to see if a melon is ripe or something, but you don't see that quite as much anymore. When you are gathering information on a patient, one that you will be administering medication to, you want to know the following information when it comes to planning drug therapy. Check out your textbook, page 3, and you will see that you need to understand symptoms, signs or symptoms, or the specific diseases that explain why your patient needs that medication. You want to be aware of current use of various kinds of drugs and medications, sometimes past use, to determine, maybe they've taken something that has not worked for them and now they need to take something else now. And you want to know any problems with drug therapy. In chapter 3, we talked about certain effects. We know we want a therapeutic effect, and a therapeutic effect that is not achieved is certainly a past problem with medication. Other problems are maybe annoying side effects, non-beneficial side effects, like we talked about, more serious adverse effects, or perhaps some sort of an allergy or an idiosyncratic effect, or paradoxical, where the drug kind of did the opposite of what it was supposed to do. It's always important to be aware of a patient's condition and status so that you can determine changes in a patient. And that's why it's always really helpful, if possible, to have the same patient several days in a row. If you're just coming in on your first day and something isn't right with the patient, you don't necessarily know if this is normal for that patient or if there's an abrupt change in the patient's status. But many times knowing that a patient's status has changed will help you know if the drug regimen itself needs to be adjusted. The next step in the nursing process is diagnosis. And when you are making a diagnosis, you are coming to a conclusion about what is going on with the patient, what are the patient's problems and his or her needs. Now, it's very important to differentiate between the types of diagnosis that are out there. We cannot make a medical diagnosis. We do not have the training or the licensure. Now, a nurse who's been practicing for quite a while, many times, you look at a patient and you're like, oh, good grief, they've got, thus and so. And you know that from your experience, but nobody's going to have you write it down and take it seriously. That is the physician's job. However, the nurse makes a nursing diagnosis, a conclusion about the various problems and challenges that the patient has, and trying to figure out what we as nurses can do to help them. Now, many times the nursing diagnosis is based on a primary medical problem. What has brought this particular patient into our area of care? But most of the time, especially when you're dealing with patients who are older, in addition to a primary problem that brings them to a clinic or a hospital or a nursing facility, there's a variety of secondary medical problems, as well as issues involving all sorts of areas: social, psychological, educational challenges, environmental issues, safety considerations, and nutritional considerations. And all of these are important for the nurse to know as he or she makes a nursing diagnosis. Now, we use a system developed by something called NANDA-I, or the North American Nursing Diagnosis Association International. That means all over the world, nurses use this particular list of nursing diagnoses when they are preparing a care plan for their patient. And you will get a copy of as current a NANDA list as we can provide. They put new nursing diagnoses out every year or every couple of years. They retire old ones, they make adjustments. And so we try to provide you with the most recent one we can, and you usually will get that in one of your med-surg classes. And you'll have to refer to that list when you're doing care plans for Miss Colette's clinical, mine, and then your other nursing instructors as well. When you're making a nursing diagnosis, and this information is found on page 4 of your textbook, you want to ask yourself a lot of questions. What, first of all, is the major problem with this patient? Many times in assignments, sorry, probably making you dizzy, when you're making assignments, maybe you're told to pick their one main nursing diagnosis. When you do your care plans for my particular clinical, I ask for, what is your patient's biggest problem? What is the issue that we are directly dealing with? Now, there are usually a number of them. You could do, 2, 3, 4, 5. Some patients you could come up with 10. But if you have to make a main one, you're looking at, what is this patient's major issue? What procedures and or medications will this patient need to have? What is needed to be able to give these medications properly? When you're talking about a newly diagnosed diabetic, they need to have knowledge of their condition, and they need to have various pieces of equipment to test their glucose and to give themselves whatever medication has been ordered by the healthcare provider. What special concerns or cultural beliefs does the patient have that might affect how they're going to react to this treatment, either positively or negatively? And what does the patient themselves understand about the disease and the plan of care?